Have you ever stopped to think that the very medication sitting in your bathroom cabinet, the one prescribed to help keep your blood pressure, cholesterol, or blood sugar under control, could actually be quietly working against your sex life? It's not something most men ever suspect, but research now shows that some of the most common medications in America might be silently affecting your ability to get or keep an erection. Hi everyone, I'm Dr. Emelia, a urologist and pelvic health specialist. And today we're going to unpack something that doesn't get talked about nearly enough: how certain medications can cause erectile dysfunction, and more importantly, what you can do about it. Because the truth is, you should never have to choose between your health and your happiness. An erection is a beautifully complex process. Your brain, blood vessels, hormones, and nerves all working together in perfect timing. When you're aroused, your brain sends signals down the spinal cord, telling the arteries in your penis to relax and open up, allowing blood to rush in. That blood gets trapped there, creating firmness. But here's the catch. Many medications can interrupt this process in three main ways. They can reduce blood flow, which makes it harder for enough blood to reach and stay in the penis. They can interfere with the nervous system, disrupting the communication between your brain and your body. They can alter your hormones, particularly testosterone, which is essential for libido and sexual performance. Now, that doesn't mean every man on medication will experience ED, but studies show it's common. In fact, nearly 60% of American men take at least one prescription medication every month, and about 1 in 5 take 5 or more. So it's no surprise that new research has found a strong link between certain prescription drugs and erectile dysfunction, even after accounting for other health issues like diabetes, smoking, or high blood pressure. Let's break down the top 5 medications that may be silently affecting your erections, starting from number 5. Atenolol, a beta blocker. If you're taking medication for high blood pressure or heart disease, there is a good chance it's a beta blocker like atenolol. These drugs are lifesavers. They protect your heart by lowering blood pressure and slowing heart rate. But here's the trade-off. Beta blockers also slow the body's sympathetic nervous system. That same system helps your blood vessels in the penis open up. When it's dampened, blood doesn't flow as freely, making erections harder to achieve or maintain. Studies estimate that around 25% of men on beta blockers experience some level of erectile difficulty. So while the drug may be keeping your heart safe, it might also be putting your sex life on pause. Number 4, Simvastatin, a statin. Now this one even surprises some doctors. Statins, like Simvastatin, are among the most prescribed medications worldwide. They lower cholesterol and protect you from heart attacks and strokes. But here's an interesting twist. Cholesterol is actually the building block for testosterone. When you drastically lower cholesterol, you may also lower testosterone levels, which can reduce sexual desire and make erections less reliable. The good news is, this effect is usually mild and most often seen at very high doses. So if you're on a statin, don't panic. Just have your testosterone levels checked before making any medication changes. Number 3, aspirin. Yes, you heard that right. Regular over-the-counter aspirin makes the list. Millions of people take it every day for heart protection or pain relief. But new research shows that chronic aspirin use may interfere with nitric oxide, a molecule essential for triggering erections. Nitric oxide acts like the ignition switch. It relaxes blood vessels and helps create that firm response. When it's dampened, blood doesn't flow as freely, making erections harder to achieve or maintain. Now, does that mean you should stop taking it? Absolutely not. The cardiovascular benefits of aspirin are huge. But if you're on it long term and notice sexual changes, that's something worth discussing with your doctor, not ignoring. Number 2, Atorvastatin, or Lipitor, and similar drugs. This is another cholesterol-lowering statin, and it works almost the same way as Simvastatin. It's fantastic at protecting the heart, but again, it can interfere with testosterone synthesis and slightly reduce libido. So if you've been on a statin and noticed changes in your energy, desire, or performance, talk to your doctor about trying a different statin or adjusting the dosage. Some statins have fewer hormonal side effects than others. Number 1, Metformin. This is a big one. Metformin is the first-line treatment for type 2 diabetes, and diabetes itself is already a leading cause of erectile dysfunction. About half of all men with diabetes experience ED at some point. The tricky part is, metformin may add to that risk. It can lower vitamin B12 levels, which are essential for nerve health, and slightly affect testosterone levels. Together, those changes can impact your body's sexual response. Now, before you even think about tossing your pills, please don't. That would be dangerous. These medications are prescribed for very serious reasons, to prevent strokes, heart attacks, and nerve damage. The diseases they treat are far more harmful to your long-term sexual health than the medications themselves. So, instead of panic, here's what you should do. Talk openly with your doctor. This is so important. Don't be embarrassed. Your doctor has these conversations all the time. Explain what you're experiencing and ask if there is an alternative medication or dosage that might work better for you. Sometimes switching from a beta blocker to an ACE inhibitor or from one statin to another can make a big difference. Optimize your lifestyle. This one is huge, and it's completely in your control. Exercise regularly, eat a balanced diet rich in whole foods, get enough sleep, and, most importantly, manage your stress. Chronic stress can disrupt hormones, constrict blood flow, and make ED worse. I've seen patients completely reverse medication-related ED just by making consistent lifestyle changes. Don't ignore symptoms. If you notice your erections aren't as strong or consistent as before, take it seriously. Erectile dysfunction is often the first warning sign of deeper cardiovascular problems. Think of it like the body's check engine light. Ignoring it can mean missing the early signs of heart disease or circulation issues. So the next time you reach for your daily medication, remember, being informed doesn't mean being afraid. It means you can work with your doctor to find a balance between protecting your health and preserving your quality of life. Erectile dysfunction isn't just about sex. It's about blood flow, hormones, and overall wellness. And with the right knowledge and proactive steps, you can take control of all three. If you found this video helpful, share it with someone who might benefit from it. You'd be surprised how many men are silently struggling with the same issue and just need the right information. I'm Dr. Emelia, reminding you to take care of your health without sacrificing your confidence, intimacy, or joy. Stay well, stay curious, and I'll see you in the next video.